Welcome to Health Careers. We are super excited that you guys decided to come on to our Zoom and watch and learn about the Health Careers class. So I'm going to tell you a little bit about myself. I am the teacher of the Health Careers class. My name is Lois McCullough. I've been a nurse for 18 years, and I've actually taught human anatomy. This is going on my 15th year to teach students in human anatomy. Health Careers is a really exciting program because it's a lot of hands-on, and you come in here, and at the end of the year, if you pass, you get a science credit, and a lot of times you'll get a couple of elective credits too. But in the spring, if you want to be a CNA, we also pick up that, and we learn CNA skills, and then come May, you can take the state test, which is a written test and a skills test. And if you pass that, you're a certified CNA at the end of the year, which is really cool for high school students because we have juniors and seniors in here. And so you can go to the nursing home and get a job as a CNA as a 16-year-old, making better money than some of the adults are. And if you don't want to be a CNA, that's fine. This is a good stepping ground towards other medical classes. You could do, since it's health careers, we could talk about anything from being a phlebotomist to being a veterinarian. We've got some in here that want to be a radiologist. So you don't have to be a CNA to take this class, but you do get a science credit. So I'm going to walk around the room, and I'm going to introduce you to some of my afternoon students and show you some of the skills that you'll be learning this year. So I'm going to flip my camera around. And right now we are studying the muscle system in human anatomy. So that is one of the courses that we're doing. And so I was just going to kind of show you what we do with when we come to our anatomy part. We've got a coloring page that they are coloring, learning about the inside of a muscle. We do some clay work in this class. This is a former student's skeleton. And so what she's done is she's put on the skeleton all of the muscles that we learned, like the zygomaticus. Then you've got your frontal muscle. So they'll be learning these muscles and taking a test over it. And so we do a lot of fun stuff with clay. Some other things that we do is microscope work. So if you've never worked with a microscope, that's something you'll get to do in this class. So this chapter, we're putting skeletal, smooth, and cardiac muscle tissue onto the microscope and looking at it. So it's kind of cool. Then you can see we've got a muscle up on the board. So now I'm going to go around and introduce students. This is Avery. Say hi, Avery. She is going to show you guys one of the very first skills that you learn in here and you get checked off. It's called donning and doffing. This is important to know when you're working with patients or residents that have tuberculosis or influenza, or like right now, we're really dealing with COVID. And so it's very important that you have your PPE or your personal protective equipment on before you go into a room, because you don't want to get this stuff either. So you're trying to protect yourself. And then, you know, as you get into the medical field and get jobs, and maybe you get married and you have kids one of these days, you want to protect your family from stuff that you're working with at work. And we've talked about some of the things that are highly contagious, like MRSA, shingles, chickenpox, influenza, and then of course you see everybody doing this for COVID. So what she's done is donned. Now she's going to doff. So she's taken off her personal protective equipment. There is a certain way you do it, a certain step that you have to follow, which keeps you from cross-contaminating. Goggles is always the second thing to go off because they're so stinking annoying. Then as she takes her gown off, if you'll notice, she's rolling it in because who knows what's on that gown. It could be blood, it could be poo, it could be pee, vomit, whatever. So it's going to go in the trash can. Last thing she takes off is her mask because she wants to protect herself from breathing stuff. Thank you, Avery. This dude over here, he's just hanging out. Okay, we've got Nevaeh and Cheyenne, and they are going to show you how to transport. So we got Nevaeh, who is the resident. So you girls go ahead and show us, how do you transport?
Hello, Miss Brenda. My name is Cheyenne. I'll be your nurse today. Today we are taking you to the living room to watch some TV.
So the patient, Nevaeh, is going to the TV room.
On three. 1, 2, 3.
So she spins her around, kind of helps her up, but we've got an issue here. Little Miss Nevaeh's feet don't touch the ground. Cheyenne had the bed up to where it was comfortable for her, so she's not hurting her back, because that's the number one thing with a CNA. You don't want to wear your back out. So she's going to put the bed down. Yes, that's the bed making that horrible noise. The beds are as old as dinosaurs. Once she got her feet flat on the ground, she's going to put her non-skid shoes on. Very important with elderly. They love to walk around with their little socks on, but that is a fall hazard. And if Nevaeh were to fall, that's on Cheyenne. She could get in trouble for that. So we're getting those non-skid shoes on. Because the last thing you want to do is have to write an incident report. It's annoying. I've written many up. Plus, it's scary for the resident when they go down. And one thing about fall risks, you don't want them falling and breaking a hip. So she's got her non-skid shoes on. Now, Cheyenne is going to apply the gait belt.
I am now going to apply the gait belt to help you. Is that okay?
So she asked the resident. Resident said, sure, thumbs up. Gait belts are used a lot in physical therapy, especially when they're doing physical therapy exercises. We use them some in nursing homes. The purpose of the gait belt is just to keep you and your residents safe. We're going to pretend Nevaeh had a stroke and she's weak on her right side. So she really can't walk very well. But with this gait belt, Cheyenne can keep her safe. So they're going to do some rocking and rolling now.
On the count of 3. 1, 2, 3.
Gets that momentum going.
Are you okay? Are you dizzy?
And she's
I'm now going to put you in chair.
She's moving her around and she's safely putting her in the wheelchair. So the patient's safe, the CNA's safe, everybody's safe. And now Nevaeh is going to the TV room. Bye. Have fun watching your show, whatever it is. Okay, now behind the protective screen, because we always have to have privacy, is our resident Tree. Hey, Tree, what's up?
I'm about to get a bath.
He's going to get a bed bath. He's like maybe totally paralyzed. I don't know. So he can't give himself his own bath. So CNA Caitlin is going to give him a bed bath. So you'll see Tree has a blanket on top because we always want to keep them covered because they always get cold. And Caitlin's going to put a blanket or a towel down on the bed to protect the bed, because the last thing you want to do is have to change sheets after a bed bath. Bed baths are easy, but very time consuming. So Caitlin has warm water in her bowl. She has asked her resident to touch it, and he's like, sure, it's fine. So now she's going to soak his hands while she starts wetting and washing the arm. The reason we soak the hand is who knows what Mr. Tree has been into this today. Everything. He has chocolate pudding. Can you see it?
Yeah.
No, you can't see it because it's not really there. We're pretending. He has chocolate pudding all over his fingers from lunch. So Miss Caitlin has to scrub all of that out from underneath his nails. So she's wet the arm. She is going to start scrubbing with soap.
Not too hard though.
Not too hard.
We're fragile.
Because what?
Old people are fragile.
Old people have very fragile skin. So you want to be very gentle in your procedures. Don't rub hard. And now she's going to rinse. Which this is kind of hard to remember all the steps because it's all pretend. There's not really water in there. But she's doing good. Now she's going to pull his hand out of the bucket and pat dry. Why don't we rub hard?
Their skin is really fragile.
Very.
Especially if they're elderly.
Good job. So she's just going to pat dry. Then this is a step a lot of people forget. After you're done with the bath, what do we need to ask him?
Would you like me to put some deodorant on you?
Yes, please.
Too bad. I don't have my arrow returned.
Yes, more so.
Applying the deodorant. Even though they're elderly, they still need deodorant. So don't forget that. And then the last step is she's going to give him a good lotion rub down. A lot of times your residents will absolutely love the lotion rub downs because it's very soothing and relaxing. So Tree, tell us, are you in here to get your CNA?
No, I am not. Oh yeah.
We're going to have him pull his mask down so you can hear him.
No, I am not. I'm in here to get my radiology at Autry, so I need my anatomy credit, and that's why I'm in here. But even if you're not in here for this CNA, it's still a fun class, and you get to learn a lot.
A lot, plus medical terminology and all that good stuff.
Yeah.
So he's moving on to radiology after this, not CNA. So he's going to be our guinea pig a lot. So, which is fine. Okay, I'm going to move over here. One of the things that you get with Health Careers is you become AHA, which is American Heart Association certified in CPR in the AED. Now I don't have an AED out, but these two are going to show you CPR. So Kaylee is on compressions and Emily is on breaths. So go for it, girls. We like to sing a song with this to help us staying alive, staying alive. Up, 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 up. 1, 2, 3, 4, 5. So you can tell compressions are pretty quick. Then when she's done with her 30, Emily's going to give 2 breaths. So that's something you're going to get in this class is certified in CPR. And also the girls are going to move over here to this table. And you also get certified in first aid. So Emily, apply that tourniquet to Kaylee. Kaylee was in the tree trying to get her cat down.
And then I
Fell, severed an artery. She's bleeding out. So Emily's going to apply the tourniquet. So in first aid, one of the things you learn is stop the bleed. So you get to put a tourniquet on and you can take that off. And then another thing is you learn how to use 4x4s. You can wrap the wound. So you can apply that and wrap it. EpiPens. You also learn, you want to show them how to administer an EpiPen?
You take the blue part out first, and then you put it into the side of her thigh. You hold it for 3 seconds, and then you rub for 10.
Very good. So you get first aid certified. You get CPR certified with this class. Even Tree, who is not going to be a CNA, still gets certified in those 2 skills. Another thing that we learn is hand washing and basic vital signs. I'm going to come back to you too. So we're going to go over here to Avery and Cheyenne. If you'll remember, they were over there, but we've moved them over here again. One of the things you have to learn how to do is weigh your patient and take their height. So we do have a for real, legit doctor scale in here. So you're going to learn how to put your patient or resident on there. So how tall is Avery?
You are 5'3".
5'3". We won't put her weight on, but we're going to show you how to do weight. It's like a balance scale. So you just move the weights until it balances. We definitely won't tell you guys how much Avery weighs because that would not be fair. So there's weight. And then once you've weighed your patient and gotten their height, you're going to do vital signs. So one thing you learn in here is how to manually take a blood pressure. Yes, when you're at the nursing home or on the hospital floor, you'll use the machine. But what if the power goes out? So it's really important that we teach you guys just like a basic taking blood pressure manually with a blood pressure cuff. Once we've learned this skill and you're comfortable with it, I send you out. You have about a couple months to get 25 vital signs. And then you'll bring that paper back to me. Those 25 can be friends, family, basketball team members, youth group members. I don't care. Anybody that you can get to volunteer to be your guinea pig so you can practice doing blood pressures. You also will learn how to do respirations, pulses, and how to take a temperature. Yay, temperature. Okay. Who was it that, Cheyenne, did you want to say something? Who was it that wanted to talk about the class? Huh? Ella. Okay, so I'm going to show you guys something that's kind of different and unique to this year. We have half of the class in the classroom and the other half is right there on Zoom. I don't know if we'll be doing this next year, but just in case, this is how it's going down. You can tell they're in bed. Some of them are looking straight at me. Others have gone, oh, there's Peyton. They go out and they feed their dogs. They go get snacks, but they have to stay in their house. They cannot leave. So we've got Ella, who's in the middle, and I'm gonna move my phone closer to the microphone. Ella, tell us about what you think about health careers.
Okay, in health careers, you will get a second family and you will laugh until Miss McCullough makes you stop so you can get back to work. Miss McCullough is one of the most caring teachers you will ever meet. I want to be a pediatric surgeon, and this class has made me realize that medicine is where I belong and that there's nothing else I'd rather be doing.
Oh, awesome.
I think you want to be in the health field, but you want to know a little bit more about it, this is definitely the class for you.
It is. This is definitely the class for you. If you are interested in any type of a health field, no matter what, this is your stepping stone. Like I said, you get a foundation, basic foundation in human anatomy. You'll get some medical terminology. You'll get health science fundamentals. So all of these are good foundation classes to spring off to either nursing or veterinarian. I even had a student 2 years ago that wanted to be a police officer, which is fine because you still need CPR, first aid, all that stuff being a police officer. I've had over the years people that want to be a paramedic or an EMT. That's fine. This is a good springboard for that.
It also looks really good on colleges.
It does. It looks very good on college applications. We do a program called HOSA. I'm glad you brought that up. HOSA, where all the health classes here at Autry get together once a month and have meetings, and we do fun activities. We just did our HOSA Fall Social yesterday where we played a bunch of stuff online. Oh, here, I'll turn the camera around.
You should tell them about Disney auditions.
Yes. With the HOSA stuff, you can compete in different categories. And if you win state, like say CPR, if you and a teammate want to go compete in CPR, you can go to state. If you win this year, internationals is at Disneyland. So that's kind of cool that if you are a type of person who likes to compete, you can go and compete at the state level and then move on to internationals. This class is not boring. How about you guys? You want to say it's not boring, is it?
No.
There's always,
Unless we're on HSF.
unless you're on HSF. I think HSF is boring too, but
That's just
It's-
partially because it's harder.
it's harder. Medical terminology is kind of some college information. So, and the bell's fixing to ring, so you'll see a bunch of the students leave. But I did want to let you guys know that if you're coming in from a feeder school like Lahoma, Drummond, Covington Douglas, Pioneer, if you take this class in the morning and you're having issues with, do I take this class or do I take a math? I wanted to let you guys know that they do offer math here at Autry. So you would be in my class for a little bit in the morning, and then you could leave like after like, I think they're in here for like an hour and a half, and then they leave and they go do the algebra. So that way you can kind of kill two birds with one stone. You can still take health careers and you can still do the math and get the math credit. So super excited. Hope you guys pick health careers next year. I'm going to turn the camera back around so they all can say goodbye because they're leaving for the day. They're actually here for 2.5 hours. These are all Enid High students, so they don't have to be in Enid High for 2.5 hours. Isn't that awesome? They're here having fun. So bye guys. Thank you. And I hope you guys decide to join health careers next year. We'll be super excited to see you. Thank you.